3 foods sitting in your kitchen right now could be the reason your stomach feels lighter and less bloated by tomorrow. Most people reach for medication when experiencing gas and bloating, but specific foods contain natural compounds that help your digestive system function more efficiently. What you eat can directly affect how much air gets trapped in your intestines and how quickly food moves through your digestive tract. This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. Bloating and gas are among the most common digestive complaints I hear from patients every single day. That uncomfortable feeling of fullness, the visible swelling of your abdomen, and the embarrassing release of gas can significantly impact your quality of life. While these symptoms might seem minor, they often indicate that your digestive system needs support. The good news is that certain foods have been studied extensively for their ability to reduce these uncomfortable symptoms naturally. Before we discuss the 3 foods, it is important to understand what causes bloating and gas in the first place. Your intestines contain trillions of bacteria that help break down food. When these bacteria ferment certain carbohydrates that your small intestine could not digest, they produce gases like hydrogen, methane, and carbon dioxide. This is a completely normal process, but sometimes it becomes excessive. Several factors can increase gas production and bloating. Eating too quickly causes you to swallow more air. Consuming foods high in certain carbohydrates called FODMAPs can trigger excessive fermentation. Constipation slows down the movement of gas through your intestines. Food intolerances, particularly lactose intolerance, can cause significant bloating. Even stress can affect your digestive system and increase these symptoms. The first food that may help reduce bloating and gas is ginger. This root has been used in traditional medicine for thousands of years, and modern research supports its digestive benefits. Ginger contains compounds called gingerols and shogals that have powerful effects on your gastrointestinal system. These compounds help speed up gastric emptying, which means food moves from your stomach into your small intestine more quickly. When food sits in your stomach for too long, it can ferment and produce gas. Studies have shown that ginger can reduce the time it takes for your stomach to empty by up to 30% in some individuals. Ginger also has carminative properties, which is a medical term meaning it helps prevent the formation of gas in your gastrointestinal tract. It does this by relaxing the smooth muscles in your intestinal walls, allowing gas to pass through more easily rather than getting trapped and causing bloating. Research published in the European Journal of Gastroenterology and Hepatology found that ginger significantly reduced bloating and discomfort in patients with functional dyspepsia. Another study in the World Journal of Gastroenterology showed that ginger accelerated gastric emptying without causing adverse effects. The anti-inflammatory properties of ginger also contribute to its digestive benefits. Inflammation in your digestive tract can slow down motility and increase sensitivity, making you more prone to bloating and discomfort. By reducing inflammation, ginger helps your digestive system function more smoothly. You can consume ginger in several forms. Fresh ginger can be grated and added to hot water to make tea. You can also add it to smoothies, stir-fries, or salad dressings. Ginger supplements are available, but the fresh or dried root is generally preferred because it contains the full spectrum of beneficial compounds. A typical effective dose is about 1 to 2 grams of fresh ginger per day. Many people find that drinking ginger tea 30 minutes before a meal helps prevent bloating and gas from occurring in the first place. The warmth of the tea also has a soothing effect on your digestive system, promoting relaxation and optimal function. It is worth noting that while ginger is generally safe, consuming very large amounts might cause mild heartburn in some people. If you are taking blood-thinning medications, you should consult your doctor before consuming large amounts of ginger regularly, as it can have mild blood-thinning effects. The second food that may help reduce bloating and gas is fennel. This aromatic vegetable has a light licorice flavor and has been used as a digestive aid for centuries across many cultures. Both the bulb and the seeds of fennel contain compounds that support healthy digestion. Fennel contains a compound called anethol, which gives it its distinctive flavor and provides its digestive benefits. Anethol has antispasmodic properties, meaning it helps relax the smooth muscles in your digestive tract. This relaxation allows trapped gas to move through your intestines more easily, reducing bloating and discomfort. Fennel also has carminative effects, similar to ginger. It helps prevent excessive gas formation and promotes the expulsion of gas that has already formed. Many people find that drinking fennel tea after meals significantly reduces their bloating and gas symptoms. Research supports these traditional uses of fennel. A study published in the journal Alternative Therapies in Health and Medicine found that an herbal tea containing fennel significantly reduced symptoms of infant colic, which is largely caused by gas and bloating. While this study focused on infants, the mechanism of action is the same in adults. Another study in the Journal of Gastrointestinal and Liver Diseases showed that a herbal preparation containing fennel reduced bloating, pain, and other symptoms of irritable bowel syndrome. The researchers concluded that fennel has a favorable effect on intestinal motility and gas reduction. Fennel works by stimulating the production of gastric juices and enzymes that aid in digestion. Better digestion means less undigested food reaches your colon, where bacteria would ferment it and produce gas. This preventive action makes fennel particularly effective when consumed regularly. You can consume fennel in multiple ways. The fresh bulb can be sliced and eaten raw in salads, roasted as a side dish, or added to soups and stews. Fennel seeds can be chewed directly after meals, which is a common practice in many Mediterranean and Indian cultures. You can also steep fennel seeds in hot water to make tea. About 1 teaspoon of crushed fennel seeds steeped in hot water for 10 minutes makes an effective digestive tea. Some people prefer to roast fennel seeds lightly before using them, as this enhances their flavor and may increase the bioavailability of some compounds. Simply heat the seeds in a dry pan for a few minutes until fragrant. Fennel is generally very safe, but people with allergies to celery, carrots, or mugwort might also react to fennel. Pregnant women should avoid consuming large amounts of fennel, as some compounds in it might have mild hormonal effects. The third food that may help reduce bloating and gas is peppermint. Specifically, peppermint leaves or peppermint tea can provide significant relief from digestive discomfort. The active compound in peppermint is menthol, which has several important effects on your digestive system. Menthol acts as a smooth muscle relaxant in your gastrointestinal tract. This relaxation helps relieve spasms and cramping that often accompany bloating. When your intestinal muscles are relaxed, gas can move through more easily, rather than getting trapped in pockets that cause pain and visible swelling. Peppermint also helps reduce the sensation of pain in your digestive tract. It does this by blocking certain pain receptors, which is why it is particularly effective for people who experience painful bloating rather than just uncomfortable fullness. The research on peppermint for digestive issues is quite strong. A meta-analysis published in the Journal of Clinical Gastroenterology reviewed multiple studies and concluded that peppermint oil is significantly more effective than placebo for reducing abdominal pain and bloating in patients with irritable bowel syndrome. Another study in the BMJ found that peppermint oil capsules provided substantial relief for patients with functional bowel disorders. The study noted that peppermint worked by reducing muscle spasms and decreasing gas accumulation in the intestines. Peppermint has antimicrobial properties that can help balance your gut bacteria. An overgrowth of certain bacteria in your small intestine can lead to excessive gas production. By helping maintain a healthier bacterial balance, peppermint addresses one of the root causes of bloating and gas. For reducing bloating and gas, Peppermint tea made from fresh or dried peppermint leaves is an excellent option. You can drink it after meals to aid digestion. Peppermint oil capsules are also available and have been specifically formulated to release their contents in the intestines rather than the stomach. The cooling sensation of peppermint can also provide immediate psychological relief from discomfort. This mind-body connection is not trivial, as feeling more comfortable can help reduce the stress that often exacerbates digestive symptoms. However, peppermint is not appropriate for everyone. If you have gastroesophageal reflux disease, peppermint might worsen your symptoms because it relaxes the lower esophageal sphincter, potentially allowing stomach acid to flow back into the esophagus. People with hiatal hernias should also be cautious with peppermint for the same reason. Now, it is important to understand that while these three foods can help reduce bloating and gas, they work best as part of an overall approach to digestive health. Simply adding these foods to an otherwise problematic diet might not solve your symptoms completely. Other dietary strategies can also help reduce bloating and gas. Eating slowly and chewing your food thoroughly reduces the amount of air you swallow. Drinking plenty of water helps keep things moving through your digestive system. Eating smaller, more frequent meals instead of large meals reduces the burden on your digestive system at any one time. Avoiding carbonated beverages can make a significant difference for many people. These drinks introduce carbon dioxide gas directly into your digestive system, which then needs to be expelled either through burping or passing gas. Even drinks that seem healthy, like sparkling water, can contribute to bloating. Certain foods are known to cause more gas and bloating in many people. These include beans and lentils, cruciferous vegetables like broccoli and cauliflower, carbonated beverages, foods high in artificial sweeteners, and dairy products if you are lactose intolerant. You do not necessarily need to avoid all of these foods, but being aware of how they affect you personally can help you manage your symptoms. The way you prepare foods can also impact how much gas they produce. Soaking beans before cooking them and discarding the soaking water can reduce their gas-producing compounds. Cooking vegetables until they are soft makes them easier to digest. Fermenting foods can actually make them more digestible for some people, though others find fermented foods increase their bloating. Physical activity also plays a role in reducing bloating and gas. Movement helps stimulate the natural contractions of your intestinal muscles, moving gas through your system more quickly. Even a short walk after meals can make a significant difference. Yoga poses specifically designed to aid digestion can be particularly helpful. Poses like child's pose, seated twist, and wind-relieving pose gently massage your internal organs and help release trapped gas. Practicing these poses regularly can reduce the frequency and severity of bloating episodes. Stress management is another important factor. Your gut and your brain are closely connected through what scientists call the gut-brain axis. When you are stressed, your digestive system often responds by slowing down or becoming more sensitive. This can lead to increased bloating and gas. Techniques like deep breathing, meditation, or yoga can help reduce stress-related digestive symptoms. The vagus nerve, which connects your brain to your gut, plays a crucial role in this connection. Activating your vagus nerve through slow, deep breathing can help calm your digestive system and reduce symptoms. This is why many people find that taking a few deep breaths before eating helps prevent bloating. Probiotics might also help some people reduce bloating and gas. These beneficial bacteria can help balance your gut microbiome and improve digestion. However, not all probiotics work for everyone, and some people actually experience more bloating when they first start taking probiotics. If you want to try probiotics, start with a low dose and increase gradually. Different strains of probiotics have different effects. Some are better for reducing bloating, while others are more effective for other digestive issues. Lactobacillus and bifidobacterium strains have been most studied for bloating and gas reduction. Working with a healthcare provider who understands probiotics can help you choose the right one. It is also worth mentioning that persistent or severe bloating and gas should not be ignored. While these symptoms are often benign, they can sometimes indicate underlying conditions that need medical attention. Conditions like small intestinal bacterial overgrowth, celiac disease, inflammatory bowel disease, or gastroparesis can all cause chronic bloating and gas. You should see a doctor if your bloating is severe, persistent, or accompanied by other symptoms like unexplained weight loss, blood in your stool, persistent diarrhea or constipation, severe abdominal pain, or fever. These could be signs of a more serious condition that requires diagnosis and treatment. Some people experience bloating due to hormonal changes, particularly women during their menstrual cycle. The fluctuations in estrogen and progesterone can affect how much water your body retains and how quickly food moves through your digestive system. Understanding these patterns can help you anticipate and manage symptoms better. When you try these 3 foods for reducing bloating and gas, give each one a fair trial. Try incorporating ginger into your diet for at least a week to see if you notice improvements. The same goes for fennel and peppermint. Keep a simple food and symptom diary to track what you eat and how you feel afterward. This can help you identify patterns and determine which strategies work best for your body. Your diary should include not just what you ate, but also when you ate, how quickly you ate, your stress level, and any symptoms you experienced. Over time, patterns will emerge that can guide your dietary choices. You might discover that eating ginger in the morning works better than in the evening, or that fennel tea is most effective when consumed immediately after meals. Remember that individual responses to foods vary significantly. What works wonderfully for one person might not work as well for another. This is because everyone has a unique gut microbiome, different levels of digestive enzymes, and varying sensitivities to different foods and compounds. The beauty of using food as medicine is that these options are generally safe, affordable, and accessible. Unlike pharmaceutical interventions, which sometimes come with unwanted side effects, foods like ginger, fennel, and peppermint have been consumed safely by humans for thousands of years. Of course, this does not mean they are appropriate for everyone in every situation, which is why consulting with a healthcare provider about persistent symptoms is important. As you work on managing your bloating and gas, be patient with yourself and your body. Digestive issues often develop over time, and they may take time to resolve. Making gradual changes to your diet and lifestyle is more sustainable than trying to overhaul everything at once. Understanding your own body and how it responds to different foods is one of the most valuable things you can do for your long-term health. Pay attention to the signals your digestive system sends you. That uncomfortable bloating is often your body trying to tell you something about what it needs or what it is struggling with. These 3 foods, ginger, fennel, and peppermint, represent natural, evidence-based options for managing bloating and gas. They work through different but complementary mechanisms to support your digestive health. Ginger speeds up gastric emptying and prevents gas formation. Fennel relaxes intestinal muscles and promotes gas expulsion. Peppermint reduces spasms and pain while helping gas move through more easily. By incorporating these foods thoughtfully into your daily routine, paying attention to other dietary and lifestyle factors, and seeking medical advice when needed, you can take meaningful steps toward reducing uncomfortable bloating and gas. Your digestive comfort matters because it affects not just your physical health, but also your confidence, your social interactions, and your overall quality of life. Taking control of your digestive health through informed food choices empowers you to feel better and live more comfortably. The knowledge that simple, natural foods can have such powerful effects on your body is both reassuring and exciting. It reminds us that sometimes the best medicine is not found in a pharmacy, but in our own kitchens. So if you like this video, please like and subscribe for more videos like this.